Yes, good evening, and how are you? How are you? Welcome to another session of Ask the Doctors. My name is Dr. Frederick Unubohai. We meet here every Sunday, 8 p.m. West African time. Now, today's program would be a question and answer session. We will take your question and then try to advise. We tell people say we know the treats for this page. The only thing we dey do for here be say we dey encourage you to go speak with your doctor. We know they prescribe medications. You understand? Yeah. And what again? So if you know say you dey hear me, tell me where you dey watch me from. No, we do small shout outs. Yeah, tell me where you dey watch me from. I can see some people here. We get Oluchi Gift dey the house. Ngozi Amina. Ngozi, how are you? Oh, yeah, Amina, tell me where are you watching me from? Where you dey watch? Where you dey watch from? Let's go. Kiki Vera. Good evening. Bethel. Good evening. How are you day? Who else again? They here. Oh, yeah, I'll talk. Watching from Deutschland. Okay, that's Germany, I guess. Okay. So if you get any question, I beg, drop them for the comment section. That is number one. Number two, I noticed say many people they talk say I want to call you, I want to chat with you privately. I they always talk say we know they do private chats. Good evening. Who is this? Blessing. Yeah. Good evening from Benin. Yeah, Ngozi. Yeah. I see you. I see you. Godwin. How is Makodi? Fa. How is Lagos? Jenny Okoye. Jenny Alpha. What do you do, Jenny? Tina, Mirabel, and Nathaniel. Tina is in the house. Tina, she's watching. Tina Alpha now, Madam Tina. How you day? How is Canada? I just do. I just did. Good evening, Olasukomi. How are you? How is your wife? Must see people, oh, see comment, oh. Oh yeah, let's share the live stream. Let's share. Mirabel from Akwa Ibom. Okay. Good evening, watching from Germany. I see you all. So if you get question, feel free to drop your question. Ask me. Now pigeon I go use talk. You understand? I did find no. Somebody say I don't know if she did yet. Somebody say she sent me 5K. That was last week or 2 weeks ago. I beg no vex. I know see I'm no vex. Yeah. But thank you. Yeah, we are good. Watching from Benin, I see you. I see people. Oh, hey, na plenty. Good evening, Obas Okonedo. I see you. Ivie, good evening. Happy Sunday. Happy Sunday from Ekiti. Good life na sense. This person know the Sabian. No, nobody say good health. It's not good health. Oh. I don't talk about good health. Mm-mm. Go and watch my slogan again. Hmm? Esther. It is not mistake. It's not good health. I know they talk say good health because in a doctor I be. Aigbedion Osaigbovo from Edo State. Favor, I see you. Una plenty you. Okay, so we get one question here. If you get question, I bet drop your question here. I dey expect my other co-host to join me this evening. When he come, we go see him. How should caregivers, that is, people taking care of their ailing loved ones, fend for themselves so as not to break down? My dear, this your question, a very very interesting one because it's not easy taking care of somebody who is sick. Now, it also depends on the type of sickness. We get some kind of sickness. If we say your loved one will get, sure, the person will fit take care of himself. Get some other sickness, the person will get, the person no go fit take care of himself. Now, only you go fit help that person. And if you no get support system, if you don't have a support system, meaning say now only you they take care of this person, you go break down. There is no two way about it. This is why we talk about you need family members to also help you take care of this person. If not only you they take care of that person, man, no lie you, you go break down physically, you go break down mentally. Esther, almost see people, oh, maybe not share, keep sharing this life. Yeah, good life now sense. Help me tell them, good life. Dele Bakari, yeah, I see you. Can too much water make someone fat? Water does not make you fat. Please, let's get this clearly. Water does not make you fat. What makes you fat is calorie, too much calorie, too much energy, too much food. Water, see, is there a brand name here? Okay, there's a brand name here. See, bottled water. If you drink only water like this for 1 week, I swear to God Almighty, you go lose weight. You know, there's what we call water fasting, right? So there's no way water will make you fat. What makes you fat is your body converting the food you have eaten to fats and storing it. Water does not make somebody add weight. Now, I've heard people say that, man, go back to my pigeon. I don't hear people talk say, and whenever I drink water, I dey fat. It's psychological. Now the mindset. Now something else they make you fat. Maybe now peace of mind. Maybe now you dey sleep well. You dey chop balanced diet, or you dey flex. Not be water. Yeah. Good evening, everybody. Oh yeah, share the live. Don't forget to send stars. Yes, you can send stars on both Facebook pages. You can send stars on the pages today. On the two Facebook pages, you can send stars. Madam Tina, thank you very much. For the last time, I remember somebody is asking me a question here. The person says, Doctor Ma, can pile be managed and treated like after taking different treatment? What do you mean by after taking different treatment? Treatment from where? I have a video I'm going to post soon. Yeah. I have a video I'm going to post soon. And that video is on pile hemorrhoid. This is March. That video might be that video might be April. I don't record the video, but I never fear edit them. There are many types of treatment for pile. It depends on the type of pile you have, and your doctor will treat you. They treat pile. They manage them. They treat them. Do you understand? So I don't understand what you mean by can it be managed? Yes, it can be managed. It can. It can. You have to speak with your doctor. Comfort, I see you. Good evening from Trinidad and Tobago. Wow. Keep up the great videos. Thank you. God bless you. Lucy, I see you. Long care term or home should be discussed in Nigeria. My madam, see, we are not ready. We see that one would never happen in the next 10, 20 years. It cannot happen. It cannot happen. You know where you did. You are in a system where they invest in healthcare. Here, health workers are leaving. Who want to do health care homes? When we haven't even made enough diagnosis, who want to do care home? Who want to invest in that? The healthcare workers are leaving. Professors are running out of the country on a daily basis. So who wants to set up the care home? Is it the government? Government may not send you. I beg go. Nobody send you. So forget that one. We are just say, I beg, let's not go there. Share the live, guys. Share. Drop your questions and send stars. Make una send me stars. For those who don't send me stars, they come. I beg. I'm not talking to you. Ngozi, I know you. Maria, yes, Maria, I know you. Even Tina, I'm not talking to you. If you know, so you never send me stars before for Facebook, send the stars. Doc, what are the benefits of okra in ulcer patients? I don't know what you mean by benefits of okra. Does okra cure ulcer? I don't know about that though. Benefit of okra and ulcer. Did you read anything that talks about okra the cure ulcer? Because online you can see so many write-up. I don't know about that. Yeah, I have shared for 15 people. God bless you, ma. What causes stomach pain after urinating or defecating? You see, urinating or defecating, stomach pain. Okay, so the word is not stomach pain, the word is abdominal pain. Number one. Number two is this. The pain will be lower abdominal pain, Abby, and lower abdominal pain. Maybe the person get problem for the GIT, that is maybe the colon, maybe the rectum, or the large intestine, or the person gets an infective process. So you know fit tell somebody online, say if you go toilet and they pain you, now the cause be this. Because many things because maybe the person poo they even they had, or the person don't they get this problem for a very long time. You don't know, you get um or the person get infection where you don't know even where you dey. So there's a whole lot to know about this, and that is one thing why they always do online. They say there are some questions you can never get the answer on social media, not because nobody want to help you, but because you the doctor, I'm talking about the licensed health professional, needs to know more about your condition before you come to tell you say see which the cause am. What is the cause of gastric ulcer? You know they watch my video, Efe. I have made a video about this. I have made a video about this, and it did my page, it did Facebook, it did YouTube. You have not watched it. I did repost some of my videos so that my new followers go feel watch them. I've made a video on ulcer, and I posted that video last year. I don't repost them. I don't repost them. I beg you have to watch it. Make it help you. Those videos they take time and energy to make. No vex. Yeah, thank you. Mr. Alex, how far now? How is Norway? Can too much sexual intercourse cause prostate problems? Huh. No, not really. What we know, what research has shown is that for men who even engage more in intercourse, who they release at least 20 release in a month or more, say it even protect them from prostate cancer. Now, so study show. You understand? But say a man where they get intercourse could get prostate problems. No, I never see any write up like that. What fruits can diabetic patients eat? Fruits that will not increase your blood sugar. You can take any fruit, but it has to be in moderation. Listen, because if somebody get diabetes, not mean say the person no fit chop anything. There's a video on YouTube on diabetes with a specialist. You can watch it. It's on YouTube, on my page on YouTube. Just go there, 1 hour video, you go watch them. You can eat anything, but it has to be in moderation. Nobody talks say because you get diabetes, totally stay away from this. Now, if your blood sugar they very controlled, you fit chop your fruits. But if your blood sugar they poorly controlled, they day high anyhow, get fruits where you go chop, you go push your sugar go up. But people will tell you say take fruits like garden egg, like your cucumber, like your carrots and the rest. But that does not mean you can't take other fruits if you they take your medications and if you they exercise. But yeah, if you send me stars, tell me that I have sent you stars. My wife is fine. We thank God for life. Yes, despite all the health challenges. Yes, sir. How to cure hip pain? Cure hip pain, madam. Waiting they cause the hip pain. If you don't know what is causing your problem, you can't cure it. Do you get hip pain in a young man is different from hip pain in an elderly man? Hip pain in an office worker, eh, is different in quotes from hip pain in a bodybuilder or an athlete. So you have to know what is causing the hip pain. If the hip pain is due to dislocation, you know what to do. You will have to reduce it well. If the hip pain is caused by fracture, you go need to correct the fracture. If the hip pain is caused by arthritis, I have a video coming up very soon on arthritis, though. Dr. Israel is in the house. If you have a hip pain by arthritis, you're going to need to manage them with medication, no permanent cure. Dr. Israel, how you doing? Good evening.
Good evening, I'm fine.
Hello. Welcome. How your side now?
I'm okay. Oh, this side is fine.
Okay. Why they say when you dey join the live stream, there's a place for headline. You're supposed to put your handle underneath your name. There's a place for name, there's a place for handle. Before editor, no problem. Hope say you connect your live stream to your audience too, right? You do Hello.
You said?
I said hope you connected the live stream to your Facebook audience.
Okay, okay. I now see the place to do, and so I do not know if it is.
Okay. So there's a question here. Can someone get pregnant in 8 months after cesarean section? Okay, Israel, you want to answer this? I've been answering questions. Oh God, your network. Oh my God, your network don't come again. Okay. Can someone get pregnant in 8 months after cesarean section? It's not advised, madam. Chinyonyere, it's not advised that a woman who had cesarean section in less than 8 months should get pregnant because that place never to heal. Hmm? It's not advised. Yeah. But if you had a CS and in less than 8 months you are pregnant, you should speak with your doctor immediately. Dr. Israel, do you hear me? Hello?
I'm with you.
Your network is breaking, oh. Hello? Oh yeah, rejoin again, rejoin again, rejoin again, rejoin again. Your network is breaking. So, madam, it's not advisable. They will tell you to wait for about 2 years. But if you know you're trying to get pregnant again and you're pregnant now, please speak with your doctor. Okay, Israel, can you hear me?
Your voice is looking like you are playing trumpet in my ear.
Exit and come back again. Your network they give problem. Okay, Joy Sunday. Dr. Israel, exit and join again. Good evening, doctor. Please, there's something I want to know. Please, I'm always having pain on my breast, especially when I want to see my monthly flow. But after my monthly flow, I will not feel the pain again. Please, is it normal or not? Yes, it's due to your period. Your monthly flow, the changes in your body close to your period, 90 cosam. It's not abnormal. It's not abnormal. Nah, the normal stuff where they go on for your body because of your period, they won't come. Yep. Okay. What is heart palpitation? Is it normal to have palpitation after childbirth? There's a video on my page on that. What's your name? Obas Okonedo. There's a video on palpitation. You come. Some of us know they watch my videos. Oh, Dr. Israel, can you hear me?
Yeah, I can hear
Hello.
you.
Okay. Good. So I made a
I
video
can
on
hear you.
palpitation, on heart palpitation, Obas Okonedo. Is it that some of us know they won't watch the video? So make I know. Make I they only put them for certain people. Okay, so I will give Dr. Yusuf the next question. Good evening. I sent 5K to you last week Wednesday. Did you receive it? No, I didn't. Yes, Mary Juliet. Now you. Thank you. I didn't. Oh, please, no vex. In no enter. Eh? No vex. No vex. Yes, I checked. I remember you told me. On Thursday again. I checked. It didn't enter. No vex. But thank you. Thank you very much. Dr. Israel, can ulcer cause heart palpitations? Hello.
Yeah. Are you talking to me?
Yes, I'm talking to you.
Okay. What can also cause heart palpitation?
Yes.
Okay, your ulcer pain mostly peptic ulcer, let's use the gastric ulcer. Most of the symptoms that people feel, sometimes they can actually have this palpitation, the heart beat fast and all that. Sometimes some of them feel very weak, and when they feel those weakness and heart beating fast, pain in their at least at the be like at the middle of the chest, be like not just the middle itself, down under the chest somehow when they go their back. So some persons can actually have those kind of pain and can still have this kind uh, palpitation somehow. But it's not like once you have it, it means say you get ulcer. No, it's not ulcer at all. It's different because many things can actually, some things can actually cause this palpitation. First, wait to be palpitation. Dr. Fred, did you hear me?
Yes, I did hear you loud and clear.
Okay. So palpitation let's just use a layman term. When people are when they hear your heart, they beat fast. Poop, 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 poop. So that's palpitation. You they hear am. And so sometimes exercise. Remember when you run, do a very serious run, and you can't stop. And you they breathe. Sometimes you'll be hearing your heart, they beat. Poop, poop, poop. Now that one be palpitation. So for where some fear can also cause it, anxiety can cause it, some drug can cause it. When person get blood or they reduce somehow, it can also cause it. So at that point, and if the ulcer they very worse, it can also cause this heart palpitation. Why for some few persons, yes, even when the ulcer is not worse, because they are feeling weak, tired, fatigue, and like I say many things they do them at that point, they can actually have it as well.
On this same palpitation, there's a video I made about palpitation. It did Facebook. So go and watch the video, yeah? I beg. To help you. The video also, I made a video on ulcer gifts. I made a video on palpitations, FA. Please watch it. So somebody's asking us a question. What's the cause of blood coming out of the nose?
You say?
Doctor, what's the cause of blood coming out of the nose?
From the noses, from nose. Now nose be that.
Nose, na nose, na nose, na nose, na nose. Na
Okay.
nose with that.
What
Yeah.
causes blood to come out from the nose? For some people, it can just be injury to the nose can actually cause bleeding in the nose. That's one of the major cause of bleeding. For people who sabi pick nose well, sometimes they can. Dr. Fred, did you hear me?
Yes, I did hear you, but your network they come, they go, but I can hear you now.
You say?
Oh my god. Your network, I beg. Join again, join again. Join again, yeah? So waiting they cause blood come out from the nose. If you get trauma, somebody knock you for nose, you pinch your nose, if you get bleeding from the nose. Sometimes if you just bleed from your nose, no cause, you go stop on your own. But if you notice, say the person they bleed from the nose and also from the mouth, person they bleed from the nose and the person they bleed from the mouth, carry the person go hospital. That is the only answer to this question. Do you understand? If you get person where they bleed from nose and mouth, carry and go hospital. But if not only the nose, sometimes there might be no just cause. Small blood will come because you get the blood vessel. There are so many videos to make to explain this thing. Get blood vessel where they are around the nose inside. Then they very light, very thin. Small thing, if you just make them tear, small blood will come out. If you put pressure, you press and small like this, you go stop. And if you see say blood they come out from the nose, no bend your head, go back. Ladies and gentlemen, make una share the live. Share, keep sharing, please. No bend your head, go back. If you see blood coming out of the nose, never take your head backward. Let the head come forward so that the blood will come out, and then you put pressure on the nose. Let's go. Okay, I'm not saying how to send stars. If you are using Facebook Lights, you can't send stars. Oh, yeah. If you're using Facebook Lights, you can't send stars. What causes doctor people? What causes dementia? Factors of types. My dear, come on now, Abba. Just go to Google and type dementia. Everything about dementia, you go read and you go tire. Dementia simply means loss of memory. The common cause of dementia na age. Most times when person they increase in age, they lose muscle memory. Another thing again, alcohol too. Alcohol they affect people memory because loss of memory. Another thing where research don't show now say person wey no dey sleep too. Person wey no dey sleep fit suffer from dementia, and there are so many other causes and so many types of dementia. Yep. Um, so basically, dementia means loss of memory, and then it gets different types. It gets even hereditary parts. It gets the one due to a certain type of protein we they develop on the brain. Get age, get alcohol, lifestyle. will also affect somebody to get dementia. Dr. Ezra, can you hear me now? Dr. Ezra, can you hear me
Uh,
now?
I'm hearing. Yeah, I can hear you.
I asked you this question, but you did not give me an answer. Is sugarcane a fruit, vegetable, or soft drink? Why are you asking this question, Gladys? But we don't answer you the last time. I remember this question and I answered you now. And madam, this your question is very funny. Oh. Is it not true? Is it that you don't know the answer, or you did try get another opinion, or you just want? I need to understand how sugar cane is never soft drink, for God's sake. Sugar cane is not vegetable. Sugar cane is a fruit. Do you understand? Some go tell you say na fruit, some go tell you say na vegetable, some will say garden egg is not a fruit, it's a vegetable. Whatever it is, as long as you are taking it, now that one matter pass, and you are taking it at the right quantity at the right time. Even if na fruit or na vegetable, e no concern anybody. E no go give me more money in my pocket. Abi, you wan write exam to know whether na fruit or vegetable. Do you understand? And hence, some go tell you say it's a fruit, some go tell you say it's a vegetable. But if you are asking for an exam purpose, you will need to do more research on that. I would go on the part of fruits. Let me just hide under fruits. But it's not a soft drink. Yeah. Uh-huh. Pastor Israel, can you hear me? Oh, ladies and gentlemen, you see why you need to send all stars. Send all stars, make we get better network. Guys, what causes growth around the vagina? Growth around the vagina. So there are different types of growth. Different types of growth. Growth could be hard growth. It could be soft growth. It could be firm. It could be painful, non-painful. Growth could be caused by infection. Growth could be caused by um, yeah, maybe infection and other stuffs or malignancy. So there are many things that can cause growth in the vagina. So the doctor will need to examine that growth and look at the growth and then classify this growth if it's something that we need to be worried about or not. If there's a need to carry out certain tests on that growth, they will carry it out. But there are so many causes of growth around the vagina. You get so many, so many. Share, keep sharing, keep sharing. People are not sharing the life. What are the chances of survival after undergoing kidney transplantation? Is it advisable to do kidney transplantation in Nigeria? So yes, there are centers in Nigeria that can do kidney transplants. Maybe one day I will invite a kidney transplant surgeon. There's one doctor. I have invited him to this program, but not on Facebook and YouTube. It was on Instagram. Yes, he has been here even twice. I will try to see. He's very busy. He works in Abuja to just come again discuss about it. So yes, um, they carry out transplant, kidney transplant in Nigeria. The chances of survival. I'm not a kidney transplant surgeon, so I can't really give you exact figures or tell you a lot. My knowledge in this area is very limited, but there are many factors that would play on the survival rate. Hmm? uh Maybe when we have him join us on the program, then we can give him this question to help us break it down. Okay. Doctor, there are some creams that when applied, it will bleach and some will be scratching and causing rashes all over the body. Please, doctor, how do we know the suitable cream for our skin? You know, good life. Na sense. It's not good health na sense. No, they change them. Come, if you are a new follower on this page, you are welcome. It's good life. No, I'm not telling you say good health. Forget that good health. I talk about life. I believe your health talks about the whole part of your life. Yeah, so good life na sense. The creams. So this is what you do whenever you want to use cream. There are things you have to find out in that cream. Even your own body. Find out which of this cream causes you itching. There are creams you should never use that contains mercury, that contains a certain amount of hydroquinone. Sometimes your doctor will prescribe cream, your dermatologist will prescribe cream wey get hydroquinone for you, and it will help you. It will help you, but nobody don't send me star today. Now, wow. Nobody talks. Nobody don't send me star. Okay, good. So you have to take note of the constituent of your cream. Sometimes they go tell you say this cream no get hydroquinone. Na lie. E dey inside, they no go tell you. And then when you use the cream, it will scratch you. Though there are very good brands in the market who people they use, they cause them problems. Um, I don't know the nature of your skin. I don't even know. You understand? These are things you have to find out first of all. The kind of skin where you get. And when you know the kind of skin where you get, then you get certain creams where you feel use when it will cause you reaction or itching. Can ulcer cause miscarriage, and is it harmful during pregnancy to the mother and baby? Ulcer does not cause miscarriage. Chinyonye. Ulcer does not cause miscarriage. Your doctors will treat you. Ulcer does not cause miscarriage. Ulcer does not cause ulcer is not among the causes of miscarriage unless you're having complicated ulcers. Your ulcer don't get complicated. Maybe you don't get perforation and the rest. Maybe, but normally ulcer no dey make woman lose belly. If you want to know more about miscarriage, you can watch the video on my page on miscarriage, or on ulcer you can watch the video. But ulcer no dey cause miscarriage. Um, God. See, ladies and gentlemen, the questions plenty. The questions are plain. So if I'm not reading your question, just know that I'm reading. See, so many questions they here. Make una no vex. So many questions. Doctor, please, what will make period? Let me chat with Dr. Israel. I'm coming. Let me find out what's happening. Doctor, please, what will make period to return? What will make period to return after appendicitis surgery? Had no period for over 1 year and 4 months because of implant, family planning. Uh-huh. But period return just after the surgery and now comes after 2 weeks. Does it mean that the implant isn't working again? I can't say why. Maybe during the surgical process, maybe you get medicine we didn't give you, maybe, or maybe your implant don't come out or your implant don't expire. Maybe you get. And I know they explained to you the effects of implants. They told you, Abby, sometimes the implant go work, you don't go see your period. Later, period will just come back again. So contraceptive too will change your period. Hmm? Yeah. My God. See question. Doctor, please, my x-ray show aortic unfolding. Please, what do I do? I'm a pastor. Why did you carry out x-ray, Pastor Michelle? Why did you carry out a chest x-ray? Who sent you for the chest x-ray? See, please listen carefully, guys. Ngozi sent me 50 stars. I'm just seeing it here. Ngozi, thank you. So I'm just seeing it here. On official. Thank you. Why did you carry out x-ray? Who sent you for the x-ray? When you carry out a test, it's important you take the results to your doctor. The doctor knows your symptoms. He has examined you. He's going to check your results. Aortic unfolding, it dey take our mind somewhere. But there's a reason why you did go for it. Who sent you for it? If you went there for yourself or by yourself, you have to take this result to a doctor. They must examine you. Yes, aortic unfolding in a medical term, just like you're telling me to start explaining gastric bypass surgery for you, or no, that one is too big. Something. So there are changes you see in the human body when somebody has a certain type of problem. Changes in the body. One of them is that they have seen your aorta. Aorta there around the heart. Now a very big blood vessel near the heart, and here it don't get small change. So your doctor will come check you, examine you, will come tell you say see. Yeah. If ulcer can cause palpitation, is it normal? You have to go watch the video gifts now. Dr. Israel has answered you. Not everybody will have ulcer and have palpitations. Do you understand? Not everybody will have ulcer and have palpitations. If your ulcer is well managed, will get palpitations. Some cases people will get the heartburn. It will make their heart they beat fast. It's a symptom. But not every palpitation is due to ulcer. This is why you have to be sure that what you have is ulcer. Hope you are not the one making your diagnosis by yourself. Hope you've confirmed. This is why I always beg people. I make the video, watch them so that you will know, you can understand more. Have you watched it? If you haven't, try to watch it so that you will get more understanding. Doctor, please, what can I do to have normal monthly flow? Because mine is changing right from time. Joy Sunday, yours is changing right from time every time. So maybe you get irregular menstrual cycle. I'm using the word irregular. I'm using maybe. So the thing is that you must have to find out why is your cycle irregular. Sometimes your cycle fit dey normal self. You don't even know say e dey normal. Do you understand? Your cycle fit dey normal and you no go know say yes, your cycle is normal. But what I have realized is that some ladies believe say if they see their period on the 1st of April, they must see their period on the 1st of May, 1st of July. That is not how period come. Period no dey come first. The dates they change, yet it's still dey normal. So you have to know wetin be the length of your menstrual cycle, madam. What is the length of your menstrual cycle? Do you know the length of your menstrual cycle? Yes or no? You don't know. If you don't know the length of your menstrual cycle, so changing dates fit come dey make you dey fear. I would advise you go to my YouTube page, watch the video on how to calculate the length of your menstrual cycle. Dr. Israel, can you hear me now?
Yeah, I can hear you.
This is very clear. How can I send star? Teach me. Ngozi, please help me reply them how to send stars. I beg. If you are using Facebook Lite, you can't send stars. Okay. Dr. Israel, we have a question here. What are the causes of bed wetting?
Dr. Fred, I think you should help me. I don't think I can think of anything now in my head.
Bed wetting. So I know when it becomes abnormal, now when the person don't be adult, you cannot say the person the bed wet. Ngozi sent another 100 stars. Ngozi, thank you. Sometimes if it be problem from the nerve sensation, you know, say there's a connection between the brain and the pelvic region. The pelvic now the area of your genital. For man, your blockers. For woman, your V. There's a connection there. For some people, that connection no dey very intact. Do you understand? If you can't make them, they don't even know when they want peace, when they want bed wet. And then sometimes if it be psychological too, some people fit get some kind of traumatic experience from small when they small. And as they grow up, this traumatic experience, abuse, fit can affect them. Maybe say they no go fit even control themselves when they're on bed. So if you know, say you get anybody with a bed where this person go need to see a doctor, and then the fit can advise to see other specialists who go fit help you. You might need to see a psychologist, a psychiatrist, or a neurologist, depending on the cause. Thank you very, very much. Who's this? Kemi says, let me see. Kemi, okay, good. Okay, can I send you recharge card, MTN? If yes, number, please. Oh, no, don't worry. Thank you. God bless. Joe is your first time. How are you? Welcome. Dr. Israel, what are the causes of bloating? Hello.
Okay, bloating.
Yes.
You hear me? Okay. Bloating. And so when some persons get many gas for their belly, so it can cause bloating. And so that's when you see, and also depend on which person some people eat at some particular time. Can also lead to that. So when they get bloating, it's not a big problem like that, which cannot be handled. So now just simple thing, and there are some simple thing that you go still need to do, and the bloating itself will reduce. So it just when there's excess gas in the stomach, and they lead to bloating.
Yeah, Dr. Israel has answered you. Excess gas. Ngozi, thank you for the stars. Ngozi Amina, I beg. Thank you so much. Ngozi sent stars. I've seen it. Okay, doctor. I mean, getting pregnant in 8 months with CS again after CS. Dr. Israel, I beg, if you react to this,
Okay, if I can understand that is the person do CS, then can't get pregnant 8 months later. Okay, if you get pregnant 8 months later, no sin as CS. Just know that one. Reason because the this former CS may never really finish before you can go get belle again. So having becoming pregnant again so early, and they will not want to try labor. So maybe you go by yourself, push no, because if they want try that thing, there's every tendency to say the belle fit burst, fit burst. So following that place when they first cut, so nobody will want to try that kind of thing. So what we will just do is they will even want to manage you very closely. Eh? They want to they follow you closely so that any small thing and then they will know what to do. So just know, say you are pregnant, you gave birth with CS, and you became pregnant within the next 8 months. That's CS. So for people, what would they say? Make we try whether they do labor by themselves. Now, if they get belle, they're born with CS. They go wait for at least 2 years. Eh? As at that time, we know say that belle, that place they go don't heal well before they go feel before we feel so okay, make they try by themselves. And that try by themselves wey we dey talk so, we no dey let dem do labour anyhow. E get where dem go try reach, we go just still carry dem go for CS immediately. We no go say make dem dey try. And during that period, we no go even still give dem some things wey we go give people wey never do CS before. So na im be the thing. So for this kind of person, just get am for mind say you may likely go you will actually go back for say another CS.
yep. I did ECH, but it's okay. So one doctor told me it's ulcer. What is ECH? What is ECH? Dr. Israel, what can be ECH again?
Another echo, this person want talk, I don't know. And
I don't know.
I don't know.
I don't know. Good evening, Imade. Okay, I'm just perfecting on how to send stars. God bless you. Help me teach them how to send stars. Good evening, doctor. Can diabetes cause miscarriage? Okay, so let me answer quickly on this. The answer is yes, number one. Number two, um, if you are pregnant and you have diabetes, you should be managed by an obstetrician. Your doctor should help you manage, you control your blood sugar so that this sugar will not affect you or your baby. Sometimes you might carry the pregnancy like that, or the problem will be with the baby. You will not even know. By the time you are giving birth, you might not even see the complications. This is why it's advisable that you speak with your doctor so that they help you control your blood sugar. Even before you get pregnant, they will help you control it so that during the pregnancy there will be no complaint. So Israel, any comments?
Yeah, not be only gynecologist needs to manage you. Yeah, the gynecologist will take care of the pregnancy part. Then endocrinologist will take care of the sugar part, the diabetic. So most of the time, teaching hospital, such person need to go teaching hospital or FMC where they really get these different specialists. However, if maybe you can't go hospital where you say now only gynecologist, yeah, and you are already on some medication for your sugar, this thing, yes, he himself will still let you know what to do and what not to do. Yeah, diabetes can actually cause miscarriage. It can even cause more than that. Even cause stillbirth and all that. So that's when you not control the sugar. But when the sugar is well controlled, it not go cause all those things.
Please, what can be the cause of high cortisol level and how can it be cured? Dr. Israel, you want to react to this?
Okay. So few well, I say few things now. Many things could cause high cortisol. The first thing now, what they produce cortisol, that's what we first of all think about. So if there's problem with the organ when they produce cortisol, it can lead to high level of cortisol in the body. Now, when you talk about the cure, sorry, we not fit tell you how to cure them for you. We will need you to go to the hospital because they will need to do um, a lot of examination for you. They need to do some investigation for you. Then they will now tell you the best treatment when you need to get. And the best treatment. The best treatment can be surgical, it can be medical, it can be drugs that you need to take. It can be say that organ where they produce cortisol need to be touched. And then that's why I say surgery in some cases. So if we don't need to touch that one, then they will need to give you some medications when go help reduce that. And there are some medication when you say when you don't overtake, take. And most of us when they take steroid, and when they take a lot of steroid, prednisolone, a lot of steroid drugs, e get where we go take and reach. It go even still lead to this. It go lead, first of all, it may lead to low cortisol in the body, but that will lead to exaggeration of all the organs to produce like say tomorrow no day, and that can actually cause another problem, can cause problem for us. So if the body they produce cortisol and you they take drugs we go see make to produce more cortisol, it can lead to this high level of cortisol. So it is very, very important that for such person, if maybe you go hospital and they tell you say, the cortisol in your body is high, make sure you make sure say now specialist you they meet so that they will also tell you the way when you go take treat them. Note, we not a treat person for you, so we not go fit cure you for you. You need to see a specialist. You need to see your doctor who go tell you what and what to do. Thank you.
Thank you, Dr. Israel, for that. The next one says, okay, non-painful small growths around the vagina. Dr. Israel, please, what would you have to advise this person? She says there's a small growth around the vagina, is non-painful.
Okay, so there are different things when they feel cause growth for the vaginal side. Now, first thing first, I want to talk. I don't know if I want to talk something, but I maybe want to go too far. So first, I think you will need to see a gynecologist to examine what that growth is. So that is the only way they can know what it is, because we know the science, so we're not fit tell you say see what it be or see what it not be. It can be vaginal what? It can be polyps, vaginal polyps. It can be because you shave, you can't get bones and all that. It can be anything. It can even be normal boy for that place. So, but because we know the science, we cannot actually tell you that this is what it is. For what vaginal what not they actually they painful at the beginning. It can be inchy, but it's not painful until later, maybe when it can't be infected. And when it even they infected, now they painful. If it's not infected, it will not be painful. And most persons they get vaginal what they will not even know. Because some of them get HPV, which they may not be aware. So this vaginal warts can lead to this growth, which is caused by HPV, human papilloma virus, and can cause those kind of growth. And it's not painful, as earlier said. It's not painful. So you need to see your doctor to do examination to know what kind of growth is that, so that they will know the line of treatment and they will give you. Dr. Fred.
Yes, I agree with you. What causes a woman who has given birth to a child to take longer time to conceive again?
Okay, let me just say like one or two things, but they may be many. But let's just I don't want need to kind of break into different group, but let's just say one or two things. But you know, at the end, we will always tell you one thing, and the one thing when we go always talk now, see your doctor. for this kind of person, we need to see a gynecologist, doctor when they specialize in treating women. Yeah. So one of the things will be how you take deliver your first pikin. Eh? If because the way when you take deliver your first pikin can actually lead to sometimes person not to get belle on time. Two, it can be hormonal issue. Dr. Fred, you just hear me?
I they hear you loud and clear.
Okay. Then two, it can be hormonal issue. Sorry say I dey laugh or something else na distract me. Two, it can be hormonal issue. So if the hormone is being altered, it can also lead to this. Another thing when physicals and some people when they use family planning. So when you use family planning for a very longer time and you can't stop to the use family planning, it can still give you some. You can still need to take some time before pregnancy can occur. So I think those are few I want to say, and then you need to see your gynecologist, which go follow you up. So another one, if it be say not be you be the problem, if it be the man, now be the problem. If it be the man, now be the problem. So that one fit lead to you not to get belle. So maybe you not just say na you, na the woman be the problem. No. So you need to see a gynecologist. As you dey go for the first time, your husband supposed to go with you, so that anything wey they want to you, he go know, and he himself need to also do some investigation. And if you be say you be same person wey be say after you don get belle the first time, after that time you come dey, as I earlier said, you dey take some family planning pills. Yes, it can still lead to this as well. Okay, Dr. Fred, you get any other thing wey you wan add?
No. You don't talk and finish. Okay, hey, say I beg for those who want purchase stars, please, I beg. This is what Ngozi says. For those asking me on how to purchase stars, please, you can screenshot it. So that let's go to the next question. I did ECG, but it is okay. So one doctor told me that it is ulcer. That is why I'm having heart palpitations. Gift, yes. So I understand what the doctor tell you, because when you get heart palpitations, they go one check if na heart problem. Maybe they checked your heart and your heart is fine. That is why they are suspecting that it is ulcer. The only time you can confirm, see waiting you get true now ulcer, now when you do endoscopy. That is why they beg you, go and watch the video I made on ulcer. I break them down. You go understand which they inside there, and how people they get them, and the symptoms, and what they fit do to take prevent, make the symptom not too bad. But if they not do that test for you, you can't confirm that what you get now ulcer. They fit they suspect because of the symptoms. Sometimes, if you get the symptom of ulcer, but no be ulcer you get, now something else now you get. So your palpitations might be related to the regions around your heart, maybe in something because or even hormonal. Even so, that video I made on palpitations, you also need to go and watch it. Ladies and gentlemen, I beg, you need to watch the video. It day Facebook, it day YouTube. Yeah, thank you. Let's go. Dr. Israel, quickly. What is the cause of unconscious anxiety? We are about rounding up.
Unconscious anxiety. I beg. Make I not come go talk with you. I don't know. I think I will leave this for Dr. Fred.
Really, the word should not be unconscious anxiety. It should just be anxiety that you don't know why. Sometimes you might not even know why you are anxious, or you get waiting they disturb you, waiting they make you they anxious. Maybe in a physical problem, maybe in a mental issue, maybe in a relationship, maybe in a finance, maybe in a work. Do you understand? So anxiety, they really get things, maybe in an accident, life events, maybe you lose someone. So there are many factors if you make somebody get anxiety, yet you feel no knows now this thing they cause them, because you are not the professional. So you go need the professional to actually take time to define out which thing they cause them, because something they really cause them, maybe in a job, maybe in a children, maybe in a relationship, husband, so many things. Nine they cause them. And then if they don't find out which thing they cause them, if he can't tell you, say, okay, do this lifestyle change, behavioral change to help you, or okay, maybe you go take medication to help you. We are about rounding up. Oh God. Good evening. Let's see. See comments. See comments. See comments. Doctor, good evening. Is there any way I can reduce my penis size? My wife is complaining. Oh my God. Dr. Israel, over to you.
Ah, ah. Okay. This question looks very. Should I say it's funny? They make me they laugh. Sorry, bros. I never see. I'm not sure. There's no way. Eh? Just okay. Let me tell you what you should do. I don't think the size is the problem. Eh? I don't think the size is a problem. Sometimes the way you use it can be a problem. It can be big, but how do you use it? That's what matters a lot. Yes, if your wife they complain, maybe they complain of pain and all that. Most of the complaint of those pain are during penetration. When you want start to the enter, that's when the pain dey. Dr. Fred, you dey hear me?
I dey hear you. Yes, so you have done well.
Okay, okay, okay. So
Okay.
what you need to do is, first of all, you need to get a lubricant. A lubricant. That one will make you get easy access. Go lead to easy access so that pain no go dey. That one na one. Two, don't be rough. Be gentle with her. Don't be rough. If you dey do fast, no. Take am slowly. Don't be no go kill am. Just take am slowly. Then three, you also need to know the kind of style you go dey use for am. You go dey use for her. Oh, Jesus. Dr. Fred.
Okay. Yes. Yes, you've done well. You've done well. I dey hear you now. I dey hear you.
Okay. Now, the other one is that this time when you dey use, you also need to, this is what you discuss with her. I don't believe saying that every style you use dey pain her. Or we go complain. So you also need to know the style you use for her that is not painful for her. Then even the style that is painful for her, if you are very gentle, e no go still dey painful. Also, if your wife dey always complain of pain, she herself need to go see doctor. If it be say she gets one or two things where they make her dey complain for this pain, and she all need to do some investigation to find out. It can just be infection. But if there's an infection for some women, they can be having pains. They can be having pains. So you need to go and she herself still need to check if not be an infection also. And so that you no go they get pain during when una dey meet. So I think when you fit do those three things when I talk, one, dey gentle with your wife. Two, try and get a lubricant so that when you want enter, you no go dey hard. You go just enter once. And three, try and know styles when she no dey feel pain. So when you get those things right, she go enjoy and she no go feel pain.
Thank you, Dr. Israel. We have so many questions and
Dr.
time
Fred,
don't almost finish.
why you dey laugh?
I dey read comments. And people dey make me laugh. I dey read comments. So time don't almost finish and questions. Make una even send us stars. Send stars, guys. Okay, let's take this. God. What causes pain in the head and upper arm? And please, how can it be treated? Dr. Israel. Oh yeah. Oh.
Dr. Fred, I don't hear you well. My network.
Hey, yeah, your network. Can you hear me now? Can you hear me?
Okay, I dey hear now. I dey hear you.
Okay,
yeah.
Good. So what causes pain in the head and upper arm? And please, how can it be treated? Let's do this very fast. We're almost out of time.
Which one?
See the comments.
Okay,
Yes.
What causes pain in the head and upper arm? And please, how can it be treated? Please, we don't feature on something. When you talk about treatment, we don't treat in this place. We only advise you. And when we advise you, we will tell you guys to go and see your doctor. Your doctor will be the one to treat you. One day we are going to do a podcast on patient behavior. Now they say go see doctor, and you guys, instead of some person go see doctor, they will first go see pharmacist. From pharmacy they'll come go lab. From lab, when they don't spend money finish, they'll come go doctor. then they'll come they beg the doctor, say, now this small amount I get, which is not good. Okay, that aside, now many things can cause head and upper arm pain, many things. So when you get headache, that's pain in the head, and different type of things can cause headache. You can be stress headache and all that. Then also when you trauma, when you hit your head for something, it can also cause pain. Stress can cause it as well, can cause those kind of pain in the head. So for your upper arm, the way when you take lie down, it cause pain to your upper arm. Mostly pain from the neck can actually lead to that place as well. If you also injure your hand, maybe use and hit something, it can also cause that. Then it depends on your age as well. You may not be having pain, you may be having something like hot flushes in that your upper arm side. For women, and they talk about women, you can just be having something like that and you'll be thinking that it's pain. And so that one feel be normal thing. For women, when they reach menopause or when they stop to see their menses, they feel they get things like that. So I think that's all I will say. For the treatment, sorry, we'll not fit treat you for yet. You need to go see your doctor. Thank you.
We are almost out of time, guys. Oh God. My man comes earlier than me. It didn't used to be like that. Okay, it started last year. He doesn't want to go to the hospital. He comes under a minute. What is the issue? I'm not someone who wants sex for longer hours. Oh, Dr. Israel, please respond.
Okay, for this, and your husband, your man really need to see a doctor. You need to see a doctor, and that's one. Then two, I don't know that your 1 minute where you they talk, it may be even longer than that. But I think you guys need to play a lot longer than having sex. So when you play longer than having sex, you may actually get to that point when before you even come, you go come. Before you come, you go come. So, but you actually need to play longer so you get wet, you get ready for everything, and when he penetrates, you just surprised that you don't even reach the point. And also for every ladies, I actually say this. I think mostly how the style that they stay when go make them quick come, then themselves quick come, quick get their orgasm. So if you know say your man be like that, say the quick come recent now, and you know the kind position when you go take, when you go quick get your own orgasm, I think you can actually use that so that make your eye not on the outside. But you really need to tell your husband to go to the hospital, and your husband need to go to the hospital. And they have some, it can leverage on eating some fruits, something like watermelon, banana, cucumber, coconut, yogurt. Yeah.
Okay. I made a video. I made a video on this too. It did my page. What's your name? Precious. You get video where I make for Facebook. The video did my page. Try watch them. Scroll through my page. You will see the video. Some of the answers where your husband needs if you find out for the video, and also try and encourage them to go hospital. Final question for today. Because of time, guys. Please, doctor, using cotton wool during menstruation is it bad? Menstruation, right? It's not good, my dear. It's not advisable for a woman to use cotton wool when she did on her menses because you see that cotton wool, if it gets small particles, where if you use them, these particles feed enter your body, it can cause you problems, infections. Sometimes this infection feed they very bad. So we know they advise women to use cotton wool or even use towel when
Now,
rag
like,
when they on their period. Cotton wool, not cotton bud. Okay, so we know they encourage women. You know, the ladies for here, in no good. Me, you know, go get toxic shock syndrome. Yes. Okay. So we have to go, guys. Thank you very much. Our time now, 1 hour we they use for this live stream. 1 hour. We they spend 1 hour here, and then when it's 1 hour, we they end them. So we don't use 1 hour. We they start by 8 p.m. They say with him, see, is it true that worm can cause one not to conceive? Worm, bow, worm where about a day. Worm. Who said so? Nobody say worm they make woman not to conceive. I don't know where you got that from. There's nowhere it's documented. I know say na market talk with this or beer parlor talk, but worm no they make woman no conceive. There's a lot of misinformation outside. Rather, please speak with your doctor if you did try to conceive. And we don't end today, I beg. It's more than 1 hour. We start 8 p.m. and we end by 9 p.m. This program is every Sunday, 8 p.m. West African time. During the week, I dey come online. So maybe you meet me during the week when I do online. If you ask me your questions, I go try to answer you. But for this program, every Sunday, and 1 hour we dey use. So no vex. And then Ngozi, yes, Ngozi, thank you so much. Thank you for the stars. Thank you so much for the stars we you sent. I appreciate you very, very much. God bless you. Today was quite educating. We did try. Thank you, everybody. Thank you for always coming. Let's see something. I hope. Let me see. Let me see. Okay. Yeah. Thank you guys for your time. Thank you. Help us share this video. Help us share the live stream. Thank you for always coming here to join and listen to our little education. God will bless you all. Remember, like I always talk, good life now waiting. Good life now waiting. Good life now waiting. Good life now waiting. Yes, one thing again, I beg, we know they do private chats. I beg, I know they do private chats. So in case you just send me a message from my inbox, I beg. I know they do private chat. I know they respond to inbox messages on social media. Unless now people we I don't know way back. Those ones. We know what they do. But on social media, on all my social media platforms, I know they do private chats. Inbox, yeah, no vex. Thank you. God bless you. Good life in a sense. Thank you so much and have a wonderful evening. Bye bye.